Nigeria is among the nations in the world with the highest number of people practicing open defecation, estimated at about 46 million people. The practice has had a negative effects on the populace, especially children in the areas of health and education. The sanitation situation in the country prompted the National Council on Water Resources in 2014 to prioritize the development of a roadmap towards eliminating open defecation in Nigeria in line with the United Nations Global Campaign for Ending Open Defecation.
2015, when we organized a retreat, invited so many stakeholders in the water resources sector, and after our deliberations we came up with a roadmap, what we call the Water Resources Roadmap 2016 to 2030. A 15-year plan, that's what we developed for the ministry, covering almost every aspect of the ministry's mandate. And along the way we introduced reforms and so many programs and projects. Open defecation, another campaign that we're doing to make Nigeria open defecation free. As at 2017, we had only one local government that is open defecation free. As at last year, we had maybe 50 something. Today, as I'm talking to you, this year, we've added more than 10 local governments. So we're like around 67. I just signed, it was 62, and yesterday I signed about 5 certificates for new additional 5 additional local governments in Benue State. So we made a lot of progress in that.
The Clean Nigeria Use the Toilet campaign is the transformational campaign aimed at ending open defecation in Nigeria by 2025. It is aimed at mobilizing all strata of the society to join hands to fight the menace of open defecation. With 46 million people still defecating in the open, equivalent to 23% of the population, according to the 2019 Water Sanitation and Hygiene National Outcome Routine Mapping Survey, WASHNOM Survey. India has almost completely exited from the committee of countries that defecate in the open, having put up a Swachh Bharat Mission (SBM) from 2014 to 2019. Nigeria understudied the Swachh Bharat Mission with a plan to also end open defecation in Nigeria by 2025. With the determination to stamp out open defecation in the country, the Honorable Federal Minister of Water Resources, Engineer Suleiman Hussaini Adamu, therefore approached the Federal Executive Council with a memo to that effect. The Federal Executive Council then approved the rollout of a national program to end open defecation in Nigeria by target date of 2025. This approval also indicated that a behavioral change campaign would be carried out for Nigerians to reap the benefits by keying into the campaign. Similarly, the National Roadmap Strategy to End Open Defecation in Nigeria by 2025 would be institutionalized. In November 2018, the national campaign was then flagged off in Abuja by the Vice President, Professor Yemi Osinbajo, GCON. Speaking at the national campaign flag-off ceremony, the Vice President, Professor Yemi Osinbajo, GCON, noted that this is a laudable program to engender good health for Nigerians and also an employment generation machinery.
It's our desire to aggressively mobilize the entire country towards ending the practice of open defecation. There is no need to debate the point that sanitation is a major public health concern and that poor sanitation adversely impacts us all. The World Bank's report on the economic impact of poor sanitation due to unsanitary or shared toilets and open defecation estimates that Nigeria loses over 450 billion annually, with open defecation accounting for about 1/3 of this amount. These costs include healthcare costs, loss of productivity, premature death, poor educational outcomes, amongst others. But perhaps some of the more dire costs of open defecation are those that cannot be quantified in monetary terms. The social costs, loss of dignity, lack of privacy, and the increased vulnerability to physical attacks and violence, especially for women and girls.
The President, Muhammadu Buhari, also promulgated the Executive Order 009, ending open defecation in Nigeria by 2025 and other related matters. This showed support for the Clean Nigeria campaign at the highest level of government in the country.
I call on all state governments to complement this effort by according the sector similar recognition to enable us work together to achieve the Sustainable Development Goals targets for water supply, sanitation, and hygiene by 2030. Henceforth, federal government support to state governments will be based on their commitment to implement the national water supply, sanitation, and action plan in their respective states, and to end open defecation by 2025. It is now my honor and privilege to launch the National Action Plan for revitalization of water supply, sanitation sector of our country. It is also my singular honor to formally declare a state of emergency on Nigeria's water supply, sanitation, and hygiene sector. I thank you all.
In order to provide oversight function for the campaign, a steering committee was also inaugurated in July 2020 by the Vice President, Professor Yemi Osinbajo, GCON, SEN, who is also the chairman for the committee. Professor Osinbajo noted that if we work consensuously, we can really make our country open defecation free by 2025. Speaking further, the Vice President said it is entirely possible and we must not rest on our laurels as we push for the delivery of sustainable sanitation and hygiene services for all Nigerians. The committee is comprised of honorable ministers, Chairman Senate and House Committees on Water, Chairman Governors Forum, Development Partners, Group and Private Sector. Altogether, 22 members make up the steering committee. Shortly after the national flag off on 19th November 2019, the states commenced their flag off to end open defecation in their respective states. While the Honorable Minister of Water Resources, Engineer Suleiman Hussein Adamu, equally embarked on state tour to garner necessary cooperation towards ending open defecation in the states.
We used to be doing very well in open defecation and hygiene. But even before your visit of today, we realized that we have to key in and hence manage, I think in the last 6 months or so, to clear 4 local governments. I'm sure if that statistics is reviewed today, I will be the second in this country following Cross River.
We speak, we are rebuilding most of our markets in Kaduna State. We are also building public toilets all over the state to address this problem. So, Honorable Minister, in the Kaduna State government, you have a willing partner that is committed to ensuring the eradication of this practice in the shortest possible time.
Some of the states have also commenced rollouts of the campaign. Most states have also declared a state of emergency on WASH and have developed their state-specific roadmaps to end open defecation, drawing from the National Roadmap Strategy. The campaign started with the flag off in 2019, with 16 local government areas declared as open defecation free. As at today, 76 local government areas have been declared open defecation free. A lot more still needs to be done, with only 3 years to the target date of 2025. Mr. Emmanuel Awe, the Director of Water Quality Control and Sanitation in the Federal Ministry of Water Resources, speaks further on the journey so far, the lessons learned and the special message for Nigerians as we begin the countdown to the target date of ending open defecation in Nigeria.
Open defecation has been identified as a great issue in Nigeria for a long time. You recall that in 2015 we started the SDG, which actually provided a clause that by 2030 all countries should be open defecation free. So Nigeria key into that, and by 2015 a roadmap to end open defecation was prepared in the country. In the roadmap, we gave ourselves a target date of 2025 to end open defecation in Nigeria. Of course, before 2019, CATS, that is community-led total sanitation, has been introduced to a number of communities in Nigeria. So by 2019, the President approved the establishment of a secretariat to fight against open defecation. That was what led to establishing the Clean Nigeria Use the Toilet campaign secretariat.
The Clean Nigeria Campaign Secretariat has not rested on its oars in the agenda of making Nigeria open defecation free. Mr. Chizoma Obara, the coordinator Clean Nigeria Use the Toilet campaign, elucidates on the basic procedure to be followed for declaring a local government area open defecation free. Presently, how many local government areas are open defecation free, and the massive work ahead to achieve an open defecation free country?
When do we begin to say that a community or a local government is open defecation free? Now, one of the approaches Nigeria is actually using to address the issues around ending open defecation is the community-led total sanitation. Now, a community, a local government is triggered to action, and they begin to, see the need to stop open defecation, having, been sensitized, and they see that the open defecation, it goes back to their water bodies. They see themselves drinking. Most of the diseases like the diarrhea, cholera are all as a result of this fecal matter that has gone into the water body. And they begin to, take that decision. It is a collective decision. That's why we call it the community-led. It's a community-driven approach. Communities begin to take collective decisions. From now on, we will stop open defecation. From now on, we will build toilets and we will use toilets. And then we have what we call the protocol, the national protocol for verification, certification, and validation of these local governments. Now, once a community is triggered to action, there is a follow-up that actually happens with the local government, and these are the different stages that that local government has to go through before you now say that local government is open defecation free.
In working towards ending open defecation in the country, there have been collaborations with MDAs, states, the organized private sector, and many others. The Secretariat identified and trained Clean Nigeria campaign focal officers for all the states and FCT for ease of communication with states. A database for the local government area focal offices has been established at the Secretariat. Another of such collaboration is that of National Orientation Agency with the availability of community mobilization officers, commerce of NOA at the local government area level. The Clean Nigeria campaign in collaboration with NOA at the national level held a one-day sensitization for all local government area community mobilization officers in all the states and FCT to reach the grassroots with the message on the campaign to end open defecation Nigeria. Again, as part of support to states on COVID-19 prevention and to stop the spread of the pandemic, the Federal Ministry of Water Resources provided water points for states as well as sanitation facilities as entry points of commercial premises for states to accelerate progress in the provision of water supply and sanitation. The federal government in addition has also engaged 100 youths per local government area across all the 774 local government areas. The national flag off was carried out in Abuja by the Honorable Minister of Water Resources, Engineer Suleiman Hussaini Adamu, on 9th March 2021.
The Partnership for Expanding Water Sanitation and Hygiene, WASH, T-WASH, is another initiative to improve access to water services in rural areas. National Youth Program was also implemented last year as part of the Ministry's COVID-19 intervention, in which 100 youths were engaged in each 774 local government areas across the country on community sensitization around hand washing with soap at critical times, the use of toilets. The rollout of these initiatives are yielding results, though not at the rate desired. According to the WASH National Outcome Routine Mapping Survey carried out in 2018, basic access to water supply improved from 68% in 2018 to 70% in 2019. Access to basic sanitation went from 42 to 44%, while open defecation rate reduced from 24% to 23% over the same period.
The program that we have put in place, the Youth Volunteer Program, to sensitize the general public right down to the rural areas on the need to imbibe hygienic practices. Simple things like washing of hands, using the toilet. This campaign is going on right now. Several states have flagged off the campaign and the youth are already out there in the field. And we're already getting reports of the successes in especially the rural areas, where people are becoming more aware of the need to be clean and to ensure that all they do with hygiene in view. So we're very happy with that program. We are also happy with the states that have also declared an emergency on hygiene. We are happy with the states that have keyed into the P-WASH program, all in a bid to ensure that by 2025, Nigeria is open defecation free and that we have clean and hygienic practices in place, not only in the urban areas, but also in the rural areas.
All states have flagged off the program. The youths that were engaged were trained and empowered to carry out sensitization at household level on proper hand washing and the End Open Defecation campaign. As at today, all states have flagged off and trained their youths who have also engaged the household with messages on hand washing and campaign to end open defecation. The youths that were engaged were paid 20,000 naira per month for the 3 months of their exercise. In order to accelerate progress and to roll out the campaign in states, The Clean Nigeria Campaign Secretariat is set to support willing states with capacity building, particularly on community-led total sanitation, which is one of the approaches being used to improve access to household sanitation facilities to end open defecation. The Secretariat will also provide support to set up states task group on sanitation for the purpose of certification of local government areas as prescribed in the National Protocol for Verification, Certification and Validation of Open Defecation-Free Local Government Areas. All of the 36 states and FCT have selected Clean Nigeria Campaign focal officers as well as local government focal officers. The officers have been sensitized by the Clean Nigeria Campaign Secretariat. The Secretariat commenced the activities of this year 2022 with a national retreat with states. The retreat, which was held on 28 February to 3rd March 2022, had Honorable Commissioners for Local Government and Chieftaincy Affairs and the General Managers of RUWASA with other key stakeholders in attendance. The aim of the retreat was to appraise the campaign, share learnings and identify gaps in order to move faster with the campaign. Only recently, the President, Muhammadu Buhari, GCFR, signed the pledge card indicating reaffirmation of commitment towards ending open defecation in Nigeria. Mr. Vice President Professor Yemi Osinbajo, GCON, and the Honorable Minister of Water Resources, Engineer Suleiman Hussaini Adamu, Fellow Nigerian Society of Engineers, Fellow Academy of Engineering, equally signed the document. The Federal Capital Territory Minister, Malam Muhammad Musa Bello, also signed the pledge card. It is interesting to know that the Honorable Minister of Water Resources meets with the campaign secretariat every Monday. That is how passionate he is about the campaign. It will be recalled that on Friday, 7th April 2017, the first local government area to be declared open defecation free is Obanliko in Cross River State. Join the bandwagon. Stop open defecation.
Open defecation is dangerous to our health. It pollutes the air we breathe, our water, and degrades our environment. It kills, it's wrong, it's unhealthy.
A healthy nation is a wealthy nation. Let us end the practice of open defecation.
Cleanliness is next to godliness. Let us stop the practice of open defecation.
Open defecation causes a disease cycle in children. Let us end the practice of open defecation.
Many children die every year because of unhygienic practices related to open defecation.
Let's end the practice of open defecation.
Owning a good toilet facility is dignifying.
Everyone has a right to good sanitation.
Women, girls, and children
are prone to violent attack when defecating in the open. Let us end the practice of open defecation.
Sanitation business is good business. Let's stop the practice of open defecation.
Come,
join us. Let us stop open defecation in Nigeria. Clean Nigeria.
Clean Nigeria.
Clean Nigeria.
Clean Nigeria.
Use the toilet. Join the fight for a healthier Nigeria. Let's stop open defecation and put an end to the needless death.